Do you frequently feel like your heart pains sometimes, even when you're just walking or not doing much? Or maybe you've noticed your skin bruises super easily, like just from a tiny bump. Imagine this: you cut yourself while chopping vegetables, and the bleeding just won't stop for a long time. That's how some people with Hermansky-Pudlak Syndrome Type 2 (HPS2) live every day. This rare disease doesn't just affect one part of the body. It hits your blood, immune system, and even the way your cells work. It often shows up in childhood, and while it's rare, knowing about it early can really help someone get the right care and live better. So what causes HPS2? Think of your body like a big factory. Every cell has instructions, genes, that tell it how to make important parts. In HPS2, there's a typo in a specific instruction, the HPS2 gene, also called a P3B1. Both parents must carry this broken gene, even if they're healthy, for a child to get the disease. It's like both parents handing their child a mix-up manual for building cell parts. Because of this mistake, the body can't make certain tiny packages in cells called lysosomes and granules in blood and immune cells. Without these, blood doesn't clot well, and the body struggles to fight infections. So it's not caused by anything you ate or did, it's something you're born with. Let's picture Sam, a 6-year-old boy. Since he was a baby, Sam bruised easily, even mild play left marks. When he got his first cut from a toy, it took over 20 minutes to stop bleeding. He also gets sick a lot, colds turn into pneumonia quickly. He's smaller than other kids, and doctors noticed his lungs were getting stiff, a condition called pulmonary fibrosis. Also, his skin and hair are lighter than his family's, a clue something's off with pigment. These signs, bleeding easily, frequent infections, light coloring, and lung problems, are big red flags for HPS2. It's not just one symptom, it's a combination that says, hey, something's wrong inside. First, they might do a blood test to check platelets, tiny cells that help blood clot. In HPS2, platelets look empty under a microscope because they're missing their storage granules. Then comes genetic testing, a little saliva or blood sample to read the HPS2 gene. If the gene shows a known error, that confirms it. Treatment isn't a cure, but it helps. For bleeding, doctors may use a drug called DD-VP before surgery. Antibiotics help fight infections, and oxygen therapy supports lungs. Bone marrow transplant is the only option that could fix the root cause, like replacing the broken factory team, but it's risky and not always possible. It's like fixing plumbing by replacing the whole pipe system. Not easy, but sometimes necessary. Can we prevent HPS-2? Since it's genetic, you can't prevent it like a cold. But families can be proactive. Imagine 2 cousins planning a family. They live in a community where HPS-2 is more common. They can get genetic counseling, a chat with a doctor who explains the chance their kids might get the disease. A simple blood or saliva test can show if they carry the broken gene. If both are carriers, there's a 25% chance their child will have HPS-2. With this info, they can make informed choices. So while you can't stop the gene error, you can plan ahead like checking the weather before a picnic. Good news, science is moving. Right now, researchers are testing gene therapy for HPS2. Imagine sending in a correct version of the broken gene into the patient's cells, like sending a software update to fix a bug. Early tests in mice showed promise, better platelets and healthier lungs. Scientists are also studying drugs that slow down lung scarring. Another idea is editing genes using CRISPR, one tiny snip to fix the typo in DNA. While these aren't ready for people yet, they give hope. For a child with HPS2 today, these advances could mean a future